It has become impossible to ignore a quiet but devastating crisis unfolding among young people today. Since around 2010, the landscape of youth mental health has shifted dramatically, with rates of depression and anxiety skyrocketing to levels never before seen. Statistics from organizations like the Centers for Disease Control and Prevention paint a stark picture. In 2023, a staggering 40% of U.S. high school students reported feeling persistently sad or hopeless. This isn't just a fleeting case of teenage angst. It is a profound and sustained wave of distress that has more than tripled from the historical average of just 12 to 15% seen before the last decade. This is more than a trend, it is an epidemic demanding our full attention. The numbers are not just abstract data points, they represent individual lives derailed by overwhelming emotional pain. For many, these feelings of sadness spiral into more severe conditions. Globally, the World Health Organization reports that 1 in 7 adolescents between the ages of 10 and 19 now experiences a mental disorder. Depression and anxiety have become leading causes of illness and disability for this age group. Tragically, these struggles can have fatal consequences. Suicide now ranks as the 3rd leading cause of death for individuals aged 15 to 29. A heartbreaking testament to the depth of the crisis and a clear signal that the support systems currently in place are failing to meet the immense need. The long-term consequences of this crisis extend far beyond the teenage years. When adolescent mental health conditions go unrecognized and untreated, they cast a long shadow into adulthood. These early struggles can impair both physical and mental well-being later in life, creating barriers to education, employment, and the ability to form healthy relationships. The invisible wounds carried from youth can limit opportunities and prevent individuals from reaching their full potential, creating a cycle of disadvantage that impacts not only the person, but society as a whole. Addressing this issue is not just about alleviating current suffering. It is about investing in the future health and stability of an entire generation. The pervasiveness of this issue means it touches every community, but some groups are hit harder than others. Research consistently shows significant disparities based on gender and identity. In 2023, for instance, more than half of all female high school students, 53%, reported persistent sadness and hopelessness. The numbers are even more alarming for LGBTQ+ youth, who face disproportionately high rates of bullying, violence, and emotional distress. Nearly 30% of these students were bullied at school, and a devastating 20% attempted suicide in the past year. These statistics are a clear call to action, demanding that we look beyond broad-stroke solutions and understand the unique pressures faced by the most vulnerable among us. To understand this crisis, we must look at the world young people have inherited, a world fundamentally different from that of previous generations. The period since 2010 coincides with the meteoric rise of the smartphone and social media, which have completely rewired social interaction. While promising connection, these platforms often deliver the opposite. The curated, filtered perfection of online life creates a relentless pressure to measure up to an impossible standard. Young people are caught in a constant cycle of comparison, where their real lives feel inadequate next to the highlight reels of their peers. This digital environment can amplify feelings of loneliness, inadequacy, and anxiety, making genuine connection feel further away than ever. Beyond the digital realm, the pressures of the real world have also intensified. Academic expectations have soared, with the path to a stable future feeling narrower and more competitive than ever before. From a young age, students are pushed to build the perfect resume, achieve flawless grades, and participate in countless extracurriculars, all while navigating the complex social hierarchies of school. This relentless drive for achievement leaves little room for rest, self-discovery, or failure. The school environment itself has also become a source of significant stress, with safety concerns on the rise. In 2023, 13% of students reported missing school because they felt unsafe, a concerning increase that shows how the physical space of learning can also be a site of fear. Bullying, a timeless tormentor of youth, has found new and insidious forms in the digital age. It no longer ends when the school bell rings. It can follow a student home, appearing on their phone screen at any hour of the day or night. In 2023, nearly 1 in 5 U.S. students reported being bullied at school, a significant jump from previous years. This constant threat of harassment, whether in person or online, erodes a young person's sense of safety and self-worth. It creates an environment of chronic stress where it becomes difficult to trust others or feel secure. This persistent state of alert takes a heavy toll on mental health, contributing directly to the rising rates of anxiety and depression. These factors, social media pressure, academic stress, and a deteriorating sense of safety, combine to create a perfect storm. They form a high-pressure environment where the normal challenges of adolescence become magnified and overwhelming. Young people are navigating identity, peer relationships, and their future aspirations against a backdrop of constant comparison, competition, and potential threat. It is not a failure of individual resilience, but a consequence of a system that places extraordinary weight on their shoulders. Understanding these systemic pressures is the first step toward finding solutions that go beyond blaming the individual and instead address the root causes of their distress. In response to this growing crisis, a popular narrative has emerged, one that places the solution squarely on the shoulders of the individual. We are told to practice self-care, take a bubble bath, try meditation, drink more water, or keep a gratitude journal. While these wellness tips are well-intentioned and can be helpful for managing day-to-day stress, they are profoundly insufficient as a response to a systemic mental health crisis. Suggesting that a face mask can cure clinical depression is like telling someone with a broken leg to simply walk it off. It trivializes the severity of the issue and can make those who are struggling feel even more isolated and misunderstood when these simple fixes inevitably fail to solve their deep-seated pain. The self-care narrative conveniently overlooks the massive systemic barriers that prevent young people from getting the help they truly need. The core problem is not a lack of individual effort, but a severe and growing gap in professional mental health services. In states like Indiana, for example, a staggering 66.4% of youth who experienced a major depressive episode in 2024 received no treatment at all. This is not because they didn't want help. It's because help was unavailable or inaccessible. Telling someone to simply reach out is meaningless when there is no one on the other end of the line, or when the wait list for a therapist is months long and the cost is prohibitively expensive. This gap in care is fueled by a critical shortage of providers. Across the country, there are simply not enough counselors, psychologists, and psychiatrists to meet the surging demand. In many regions, especially rural and low-income areas, entire counties are designated as mental health provider shortage areas. For every one mental health provider in Indiana, there are 500 residents, a ratio far worse than the national average. This means that even families with the resources and determination to find care for their children often face an impossible search. The problem is not a lack of resilience. It is a lack of infrastructure. Self-care cannot build the clinics and train the professionals that are desperately needed. Ultimately, the overemphasis on individual coping strategies distracts from the real structural problems that are fueling the crisis. It is far easier to sell a wellness app or a bath bomb than it is to advocate for policy changes that fund school-based mental health services or increase insurance coverage for therapy. When a student is being relentlessly bullied or feels unsafe in their school, no amount of deep breathing will fix the underlying environment. The self-care movement, in its commercialized form, can inadvertently become a tool for shifting responsibility away from institutions and onto the very individuals who are suffering the most. True solutions require us to look beyond the individual and toward the systems that are failing them. If individual self-care is not the answer, then what is? The path forward requires a fundamental shift in our approach, moving from individual responsibility to collective action. Real solutions lie in building robust systems of support within the environments where young people spend most of their time, their schools and their communities. We must create a safety net that is woven into the fabric of daily life, making mental health support visible, accessible, and normal. This means reimagining schools not just as places of academic learning, but as hubs for well-being, equipped with the resources to support the whole student, emotionally and socially, as well as intellectually. Programs like the CDC's What Works in Schools provide a blueprint for this kind of systemic change. These initiatives focus on creating a positive and safe school climate where students feel a sense of belonging and connection. This involves implementing comprehensive anti-bullying policies, training teachers and staff to recognize the signs of mental distress, and integrating social-emotional learning into the curriculum. A crucial component is embedding mental health professionals directly into the school setting. Having counselors and therapists on site removes significant barriers to access, such as transportation and cost, and allows for early intervention before a student's struggles escalate into a crisis. Community-level support is equally vital. After-school programs, community centers, and local health clinics must be empowered to play a role in youth mental health. This can be achieved through initiatives that promote mental health literacy, such as Youth Mental Health First Aid, which trains adults to identify and respond to a young person in crisis. By equipping coaches, librarians, and other community leaders with these skills, we create a wider network of trusted adults who can offer support. Furthermore, communities can foster environments that promote positive development by investing in safe public spaces, recreational activities, and programs that connect youth with mentors and positive peer groups. Funding and policy are the engines that drive these systemic changes. Advocacy is needed at the local, state, and federal levels to secure the necessary resources to hire more school counselors, expand access to care, and enforce mental health parity laws that require insurers to cover mental health treatment as they would physical health treatment. It is a long-term investment that pays dividends in the form of healthier, more resilient young people who are better equipped to learn, thrive, and contribute to society. Moving beyond the individual is not about absolving personal responsibility, but about creating conditions where every young person has a fair chance to be well. Even with perfect systems in place, one of the most formidable barriers to care remains stigma. For generations, mental illness has been shrouded in shame and secrecy, treated as a personal failing rather than a health condition. This deeply ingrained cultural taboo can make it incredibly difficult for a young person to admit they are struggling, let alone ask for help. They may fear being judged by their parents, misunderstood by their teachers, or ostracized by their peers. This fear is especially potent for marginalized youth, who already face discrimination based on their race, ethnicity, sexual orientation, or gender identity, adding another layer of complexity to their decision to seek support. For youth from marginalized communities, the challenge of finding care is twofold. First, they must overcome the societal stigma, which can be compounded by cultural beliefs that discourage discussing emotional problems openly. Second, they face a healthcare system that was not built with them in mind. There is a significant lack of culturally competent therapists who understand the unique stressors associated with racism, poverty, or navigating a world that is hostile to one's identity. This can lead to misdiagnosis, ineffective treatment, and a profound sense of distrust in the medical system, further discouraging them from seeking the help they desperately need and deserve. Breaking the silence is therefore a crucial act of public health. The most powerful tool we have against stigma is open and honest conversation. When influential figures, community leaders, and peers share their own mental health journeys, it normalizes the experience and chips away at the shame. Schools can play a pivotal role by integrating mental health education into their health classes, teaching students to recognize symptoms in themselves and others, and providing clear language to talk about their feelings. Fostering an environment where asking for help is seen as a sign of strength, not weakness, is essential to ensuring that no young person suffers in silence. The fight for better youth mental health is a fight for the future. It requires a multifaceted approach that combines systemic investment with cultural change. We must build schools that are safe and supportive, fund community-based resources, and ensure professional care is both accessible and affordable for everyone. At the same time, we must continue the hard work of dismantling stigma, celebrating vulnerability, and promoting empathy. While the statistics are daunting, there is reason for hope. By recognizing the scale of the crisis and committing to collective, compassionate action, we can create a world where every young person feels seen, supported, and empowered to lead a healthy life.